This conference will now be recorded.
There we go.
It's working.
All right. So, hi everyone. My name is Frank Rivera. I want to thank you all for coming. I know a lot of people are leaving to go to FSR training, which is the national training. So I do appreciate that you did come through, and you know, today I know it's going to be a little bit different because people are going to be dropping in and out. So I do want to talk just to see, give everybody a chance to have a 30-second explain themselves, who they are, where they're from, and when were you diagnosed. All right, I am going to start with Agnes.
Okay, I live in Southwest Iowa. I was diagnosed probably in 2007 when my eyes inflamed with sarcoid uveitis. So then it left, then I found out I have it in the lungs, I have it in the skin and the lymph nodes. And it was dormant for probably about 3 years. And then about 2 years ago, we went through some stress at work and of course it started up again. So now we're dealing with it all over again.
You're muted, Frank.
Yeah, I see that now. Well, welcome aboard. Thank you for coming. I'm going to start with, again, with Kathleen now for next.
All right, I unmuted myself. Hi, I'm Kathleen Turano. I live on Long Island, New York. I work with Frank with Sarcoidosis Long Island for the past, I think we've decided 4 or 5 years. So I'm currently the vice president and home of disability. I've had sarcoidosis for about 10 years. I'm currently dealing with a lot of cardiac sarcoidosis. So Tuesday I go in for the EP test, which will either bring me a loop monitor or a defibrillator. So we'll see what that comes out of. I've had a double biopsy on my leg for small fiber neuropathy also last week. Failed the tilt test, yay, passed out. And sarcoid is pretty much throughout my whole body. The only place it's not right now is kidneys and eyes, and we're checking for neurological. So I'm also an FSR ambassador, but I will not be going to training because I have to work this weekend. That's it, Frank.
All right. Thank you, Kathleen. Chasta, can you give us a little bit about yourself?
Yes, I can. Hey, everybody. I am Chasta, Chasta Posey from Greenville, South Carolina. I'm the down south chick, and I'm the baby, probably the baby of the I am the baby of the crew. Yeah, I am. I'm the baby of the crew. I have been affected with sarcoidosis since 2005, which makes this year my 15th year anniversary. And where am I affected? Everywhere but my heart, neurological, and my liver. Those are the only 3 places I don't have it, but everything else is affected. I work with a lot of people. I do a lot of things. My resume is growing by leaps and bounds. I'm working on a whole lot of stuff for 2020. Y'all, I'm tired. I'm tired and sleepy all the time, and I stay hungry. So that's me. I love ice cream. So if you want to make me happy, give me ice cream.
What flavor?
I'm not picky. I just like ice cream. But I love anything with pecan and caramel.
That sounds good.
Yeah.
Okay. Well, Jennifer, how about you just, give us a 30 seconds.
Hello. My name is Jennifer Ferrillo. I'm from Tinley Park, Illinois. I was diagnosed in 2009. I have it in my lungs, liver, lymph nodes, in my abdomen. Who knows where else? They're checking the heart soon to see if I got it there. And I just keep going, I guess. That's me.
Well, thank you for coming back. All right, how about you, Ruby? Ruby?
Sorry about that. Yes, I live in Floyd, Virginia, which is a small town, but it's near Virginia Tech, and I'm sure you guys are familiar with that. But anyways, that's Southwest Virginia. I was diagnosed in 2008, and it hit my lungs, but I had issues, way before that. But when it hit my lungs, it was really bad. But it's in different areas, and I get tired of talking about it sometimes, wherever it is. But anyways, that's it.
Well, thank you for coming. Victoria, how about yourself?
It's funny because I was thinking about when I was diagnosed, and I believe it was 2018 in March, and it was an incidental finding. They found, nodules on my lungs, and went for the biopsy and whatnot. And my biggest issue, I think, is tired. I'm not one of the lucky people that's losing weight. What else? And I have a lot of lymph pain under my armpits, which at first the doctor kept saying that it was nothing to do with the sarcoidosis. He was like, it's from the surgery, but it's been on and off. I think that's pretty much my biggest complaint. But I do my best not to focus on being tired. Like I get up, I get going every day. I do what I got to do. I don't stay in bed no matter what. I feel very blessed in the sense where I'm right now I'm taking something Trexin, and that's been working. But I just kind of feel like a little tired with it, but it's keeping everything pretty much at bay. So, and I'm very grateful I actually remembered to call up because I keep missing the meeting. I'm like, oh, geez, it was last night. So thank you for your gentle reminder there.
No problem.
Thank you.
And thank you for coming.
And I'm from Long Island, New York, as you could probably tell.
All right, and a little bit about me. Like I said, my name is Frank Rivera. I'm from Long Island, New York myself. I was misdiagnosed in 2004, and then truly diagnosed in 2011. I've had my own organization, Sarcoidosis of Long Island, for just past 9 years, the 9-year mark, and actually just passed my 9-year mark in January for the my diagnosis. I have it in everywhere except for my liver and kidneys. So everywhere else is fair game for me. So I did want to ask, I'm going to go down the line to see if anybody wants to speak about anything. When I ask, if you say yes, I'll call you back. I just want to get an idea of how many people do have anything to speak about today. And James, I know you like to listen, so that's why I didn't call your name. But if you want to speak about, you're more than welcome. No, can't hear you. Okay, all right. So, now I'm gonna go down the line. Agnes, did you have anything you wanted to speak about today? I can't hear anybody. Is it just me?
No, it's not just you. I can't hear anybody either.
I hear you.
Me either.
I'm still here and I can hear everybody.
Right.
Agnes, did you
Are you
say?
with us, Agnes? Maybe she stepped away for a minute. Come back to her.
Yeah.
Not-
Kathleen, did you have anything? Okay, Agnes, I see you back. I'm sorry. Did you have anything you wanted to speak about?
No, not tonight.
Okay. And I think Kathleen stepped away. Did she?
Yeah, Kathleen stepped away for a second.
Okay. How about you, Chester? Did you have
I'll
anything?
just monitor.
Okay. Jennifer, did you have anything that you wanted to speak about?
Maybe.
Maybe. Okay. And how about you, Ruby?
Nah, not tonight.
Okay. How about you, Victoria?
Well, I always have questions. So I don't know if that's considered, speaking about something or just
Yep.
asking questions.
Oh, no, that's no problem. I will come right back to you. I'm gonna actually, I think Jennifer, you said maybe. So, do you want to talk about anything?
I guess what I'd like to know is how does everybody else deal with the emotional backlash from having to deal with all this constantly every day, ongoing forever?
I'll start with answering that question. Um, one thing that I tell a lot of people who I come in contact with, there is absolutely nothing wrong with seeing a therapist. Absolutely nothing wrong. You need to find somebody who you can lay everything out on the table to. Find that family member who's not adding stress. Find that family member who is willing to be that listening ear, who's not always quick to talk, but just sometimes, because sometimes just getting it off your chest makes you feel so much better. Therapy is not I'm more than certain in every area of the United States there's a therapist somewhere who's not charging an arm and a leg. And if you need help finding that person, I mean, we have different avenues to where we can help with that. But see a therapist. If you don't have the supportive family members like you think you need, find a support group. There are several support groups in the social media world. There's several support groups in different areas. And what city are you in again, Jennifer?
Illinois.
So we can get you in contact with the people who have the support groups in Chicago. I know of 2 right now. And Frank and I can work together with getting you in contact with those people who have the support groups in Illinois. And I think both of those people are also FSR ambassadors, advocates, if I'm not mistaken. So we know they know the struggle. We know they know the emotional side of this. You can't, trust me, you're not going to be able to do this alone. Not going to be able to do this alone. So you got to have that support team. And sometimes our families just don't understand because they're not going through what we're going through and what we have to deal with. So
In all honesty,
yeah,
I don't think a therapist would know what I'm going through either. I think you guys would probably be closer to understanding than any therapist.
She's looking for empathy, not sympathy, is what.
Yeah, pretty much.
Okay.
I want to hear that other people go through the struggle too.
Okay, and again, that's where the sarcoidosis support groups will come into play, because they are right there along with you. And even though the actual dealing with the illnesses are different, you're still dealing with some of the same things.
Yeah, one of our moderators is Brenda Harris, right?
Mm-hmm. Yep.
She is in Chicago. She's
That's
had
close.
it. Yeah, she's had sarcoidosis since the 80s, I think.
20 plus years. Mm-hmm.
Yeah, yeah, she's had it for a while, so she would be a very good contact. I will get in touch with her and have her reach out to you.
Okay.
Okay, and she also has a support group. So and she might be able to help you a little more about in that area, and so I think she would be a really good contact. There's who else is over? Mark Landiak. He's in Illinois also, and he has a support group also.
And he wrote
So
an awesome book too. Mark wrote a
yeah,
book that also touched on the emotional side
yes,
of dealing with the sarcoidosis and stuff too. So, you know, his literature helped a lot as well. So
yes. So what I'll do, Jennifer, I will definitely get in touch. I'll definitely see Brenda. I don't know if Mark's coming or not. I haven't heard to the training, but I know Brenda is going to be at the training, so I will talk to Brenda tomorrow and let her know about you, and this way she can contact you. Okay?
Sounds good.
All right. Victoria, I
Thanks.
know you. Did you have anything else, Jennifer?
Nope.
Okay. How about Victoria? You said you had some questions.
Yeah, I had some questions. Like one was, what's the training for? I was curious about that.
Okay. With, there's a national organization called Foundation for Sarcoidosis Research.
Mm-hmm.
All of the moderators that we have on this online support group are part of that organization as ambassadors. What we do is we're here to help you guys. That's our job, not just on this online support group, but in everything. We have ambassadors all around the United States. And Victoria, since you're in Long Island, you have two right here today. uh, so yeah, our job, we have different jobs when we train, but we're all very well rounded. So what they do is they give us updates on the training, and just to make sure that we know of all the new stuff that's actually going on.
Okay.
So, okay.
All right. That sounds.
And so, next question.
Next question was, I was just curious. I know they have like trials
Mm-hmm.
of certain medication, and I'm just like so sensitive to stuff that I'm always like petrified to try something else. I take other medication too. I have bipolar as well, and I take stuff for thyroid, and I'm just like, all right, so like how does I'm curious how that works. If you knew anything about it, and if anyone's ever gone for it and tried it.
Yeah, certain medicines do have their own drawbacks and side effects. So
Mhm.
we do have to be careful with that. Um,
also, Frank,
yeah,
before you finish that,
go ahead.
they will monitor you. I'm actually in the midst of a trial now.
Yeah.
So
Oh.
they'll check you out before they even allow you to do the trial to make
Mhm.
sure that your body will withstand and hold up. They'll check and see what all you're allergic to, what your body has been able, like if your body rejected the medication. They'll do those type of tests and stuff to see if your body is even conducive to what the trial is.
Yeah.
Okay.
So and that if that let go some of the apprehension you have, because I was like that too. I was like, I ain't gonna do all that
Mhm.
because I was just like, I don't know what it's gonna do, how it's gonna make my body feel. But they did, when I say they did a thorough check of me before we started the trial that I'm in now, and everything like that, to where I mean even down to 6, 7, 8 tubes of blood work.
Wow.
Like, yeah,
Mhm.
they went
Oh yeah.
thorough
Yeah,
with
they're very.
the pre-testing and stuff of you doing a clinical trial. So if that lets if that releases some of the apprehension you have, trust
Mhm.
me, they're going to check you out before to even let you know if you qualify for the trial.
Okay.
Yeah.
All
Um,
right.
the one thing about trials that you have to understand is they want the perfect person who's going to fit that trial. So
Okay.
if they have any apprehension that you will not, it will not work for you,
Mhm.
they're not gonna let you be part of the trial anyway. The whole idea of the trial is to get good results so they can get to the next stage, so they can get their medicine out there. So they don't want somebody who might skew their stuff in the wrong way. So they will be more apprehensive than you are about making sure that you're okay.
Okay.
I'm just going to interrupt you 1 second because we have a caller here. Caller, can you just tell us who it is?
This is Beth Martinez. I'm fairly new to the group, and I'm from Grand Rapids.
Well, welcome.
Thank you.
Okay. Victoria. Oh, James, you sound like a robot there.
What happened? Is that my phone?
No, that was James. That was James.
Oh, that was it.
I guess James is trying to talk, but we can't understand him. I'm sorry, James. Oh, I understood the okay.
James, can you type it?
Yeah, if you type it in the chat and we can answer you from there, that would help. Beth, I'm gonna just really quickly, if you could give us like 30-second of who you are, where you're from, when did you got diagnosed? Okay. For some reason, James, you sound very muffled.
I'm going to reach out to James.
Okay. James, unfortunately, we can't hear what you're saying. Hold on 1 second, James.
I got it.
Going to reach out to you. Beth?
Yeah, can you hear me?
Yes, I can hear you.
Okay. I'm Beth Martinez. I'm from Grand Rapids, Michigan. My diagnosis, I had a biopsy like about 2 months ago, but I started having problems back in October, and it's just taken so long because they were in my spleen and they were trying not to do a biopsy that I went to infectious disease, cancer, and hematology, gastro before I finally ended up getting the biopsy of my spleen and figuring out what's going on.
Okay. All right. Yeah. Unfortunately, yeah, they call this disease of exclusion for a reason. They exclude everything else out first.
They sure do.
I know. And unfortunately, I mean, they're saying that it takes an average of 7 years to actually diagnose somebody with sarcoidosis. And I know that for me, it was exactly 7 years from my misdiagnosis. So, but welcome to the group. Glad you were able to come here. Did you have any questions also?
Not at this time. I've been kind of following online on Facebook, so
okay,
it's a little bit of a ride for me to get there, so I just thought I'd follow tonight.
Oh, okay. So Victoria, did you have anything else that you wanted to ask?
Yes.
Okay, go ahead.
All right. So, I have like some shortness of breath, nothing major, and I don't take anything for it actually, even though like the doctor's like, oh, you should take it, and I do some deep breathing instead. So I'm just kind of wondering, I have a pulmonologist. I feel like I'm not having a lot of symptoms. So I haven't gone into Manhattan. I haven't seen any other specialists besides a pulmonologist that deals with sarcoidosis.
Okay.
So I'm just kind of wondering, like, should I be, well, not should, would it be a wise idea to just get checked to see if anything else is going on internally? Instead of thinking like, okay, everything, like I'm feeling pretty good, and, like I don't want to be in denial of anything because sometimes I go into that because it's easier for me to deal with it. So I'm just kind of wondering.
Yeah,
you guys have any suggestions?
Here's what I would say. I don't know if everybody believes this one. If you don't have that many symptoms, don't push it.
Okay.
We see Morgenthau at Kathleen and I also see Morgenthau at Manhattan, and he's a big believer of, he's not a big believer of PET scans because if you do a PET scan, it may show that you have it somewhere else, but if you have no symptoms, why would we want to treat it and it could act up? You know,
Right.
and like for me, he said it's not worth for me to get another PET scan anymore because we know you have it in most of your body. And yeah,
Mhm.
even if you get it in your kidneys or liver, but he goes, if you're not showing any symptoms of it
Mhm.
with a blood test and or the other test, he's like, it's not worth it. You don't try to fix something that isn't broken
Okay.
because what happened is you got a lot of these drugs are also immunosuppressants, and that can also hurt your body, the other parts of your body even worse actually.
Okay. All right. Thank you.
Anybody else want to add to that?
Could you talk to James and see if he fixed his audio?
Hey James, can we hear you?
He sent a message back, said that he didn't know if it was fixed or not, but he
Yes.
did rejoin.
James, are you there?
Can you hear me now? Sorry.
You are there.
Oh, great. Finally.
Welcome.
Sorry, my name is James. Sorry to all the problems. I am from the San Francisco Bay Area. A year and a half ago, I was diagnosed with a nodule in my lung. It turned out to be benign, but a PET scan found out that I had it on my heart walls and that I have atrial fibrillation as a result. So I've been on the good old prednisone for about 4 months now, and I think it's working. So I have a couple of questions
Okay.
that I'll ask, and maybe you can save them for later. One is there is it pretty often that it affects the heart as well? I know other organs can be involved, but I'm most interested in my heart. And second of all, is prednisone a pretty reliable, I won't say cure, but it's the treatment for it. Um, is it something that I'm not sure the right words I'm looking for. Does it work? How's
There
that?
are no right words for prednisone. Period.
I was waiting for you to end because just gonna tell you the side effects of prednisone are horrendous.
Yes.
And they can actually kill you just as much as and I'm not trying to scare anyone, but it is the truth. We those the people that have been on it for a while, I'm sure Kathleen and Chasta will, and I saw Trina actually sign up in here, would be able to tell you that the side effects of prednisone, that it can hurt your bones, weaken your bones. It can give you diabetes. There's a lot of different side effects. Unfortunately, the list is ever so long. So you don't want to stay on it too long. Yes, it works. If you're on a small dosage, it won't hurt you as much. But if you're going over anything over 20, is really is where you have to watch out if you're on that for an extended period of time, and make sure that your doctor is checking all your levels.
Okay, that's very helpful. Thank you.
Yeah, and also with the prednisone, you have to know your body.
Yeah.
And you have to make sure not only is your doctor monitoring you, you have to make them monitor you. And you have to monitor yourself because that prednisone can do some serious damage. Just don't be like me. I was a hard-headed teenager. And I took myself off my prednisone several times. So, and it was
I have
based
to.
on how my body felt. So you have to base it on how you feel also, and know your body. You have a new body now. It's called a sarcoidosis body. So you have to relearn yourself all over again.
So you raise an interesting question. I'm told, and I'm not sure this is true, that once you start taking prednisone, you need to taper off of it because
Yes.
of, yeah, okay.
Yes,
Thank you.
definitely.
That's an easy question. Yeah, that's a yes. If you go off cold turkey, your body is going to overreact. And I've actually found out the hard way.
I
But
did too.
I didn't. I always listened.
the
Also,
one
hope
other
that
thing, I mean, like I said, I don't want to scare you about the prednisone, but like what Chasta said about knowing your body, I had really bad stomach pains one time, and I went to the hospital, and I knew something was up, and they were telling me they did a X-ray, didn't see anything, and they was just saying now because I have IBS. Oh, it's your IBS acting up, and I'm like, no, it's not. They did a CT scan. I ended up with a hole in my colon, and that was actually from the prednisone. So
Yikes.
yeah, yeah. So that's why you don't want to be on. I would. This is before I knew what was going on. I was on 40 to 60 milligrams for over a year and a half.
Wow.
Yeah, that's not a good one.
That's so true. Also with the prednisone, you don't want to quit cold turkey because you can cause a reaction with the cardiac.
Yes. Yeah.
So before I put myself back on mute, I just want to thank you for this forum. I discovered this by accident, and I just can't tell you how valuable it's been for me. So thank you.
Thank you for coming.
Really, thank you for coming, James. Seriously.
Yeah.
And
And
we,
Jay, take
Thanks.
yourself off mute anytime you feel like it as well.
yes.
We are,
And,
everybody's really happy to support you.
yeah, we're all here for everybody. And if you have any questions, you can contact any one of us, and we'll be able to help you out if you have any other questions.
Frank, would you put your email address in the chat window for everybody so they can see? I just wanted to say one thing about prednisone. So most of you know I'm just here sort of to support the moderators. I fortunately am not a sarcoidosis sufferer, but I do have very good experience supporting people on prednisone for another disease. And I know one person that their doctor, who is a renowned oncologist, forgot to tell him about tapering when his medical team forgot to tell him. And over a period of 3 or 4 months, this guy dropped about 40 pounds. He went from around 180 to about 140. And that was just as a result of stopping cold turkey. So I just want to say, be very, very careful when you come off of the prednisone to do it gently.
Yeah. His 40 pounds I found, Rick, okay? So gave it to me with the prednisone.
Okay.
I was going to say, that's another side effect, James, that you have to watch out for is your weight. You'll get the weight gain while on prednisone. You have to be very careful with that also.
Do not shop at all without somebody with you to stop you.
Oh, that steroid grocery bill is about to be extremely high. Extremely high.
So I see we have a couple of new people in here that just came in. Mary, hi, how are you?
I'm good. I'm late to the party. I'm sorry.
Thank you for coming.
How y'all doing?
All right. You want to just give a 30-second introduction for the people who new people?
I'm Mary Morlino. I live in Maryland, and I have mostly cardiac sarcoidosis. I've had it for a good 5 years, probably longer, typical long diagnosis. And I've been advocating for a good 5 years since diagnosis. And I actually work for the Every Life Foundation, who is hosting Rare Disease Week. So if anybody's going, please come find me. No, Shasta, I see you shaking, not happening.
Not this year. I'm Rare Disease Week out. We've done Rare Disease Week for the last 4 years.
Yeah, and the problem with us is that
we're tired.
Yeah, because we have our training the week before it.
Yeah.
No, it's such bad timing in a sense.
Yeah.
Terrible time.
I do so much. I know I went last year and I was just exhausted by the end.
Yeah.
Yeah.
Who's
So
coming down for the FSR training?
I'm sorry?
Who's coming down for the FSR training for the
Everybody but Kathleen.
Chasta will be there. Myself, Trina will be there. Regina, Brenda. Rodney's not going either.
No, Jessica Reed will be there.
Yeah, Jessica
Kathy Wick
Reed,
will be there.
Susie
Oh,
Torres.
Kathy's going. Kathy,
Yeah,
am I?
Kathy will be there. I'm actually waiting. Myself, Trina, Kathy, and Regina are gonna ride from the airport together.
Oh God, I have to talk to Kathy because I used to live in New Jersey, but now I live in Maryland. And Kathy and I want to see you guys. So I had texted Frank earlier because I was like wanting to find out your schedule if I can come. I know that your schedule is probably packed full, but if I could pop over because I'm working downtown. Where are the events happening?
It's gonna be at the 4-H
4-H in
conference
Chevy
center.
Chase.
Is that in like downtown DC?
No, it's in Chevy Chase.
Oh my God, that's even closer to me.
We actually, so when I was looking at the agenda, we have a window from 2:30 to 5:30 where there's nothing going on. They're going to be transporting people who are leaving on Sunday to go back to the airport and stuff from 2:30 to 5:30. So if you have that free time, that period, that would be great if you could come over then, Mary.
Yeah, is that Saturday or Sunday?
That's Sunday.
Okay. Yeah, I don't have anything on Sunday. That would be awesome. And Chevy Chase, I live in Silver Springs, so it's like
Oh,
one.
yeah, you're close then.
Yes. Somebody
Okay.
sent the location or, where it would be. I would love to see you guys.
I'll text you the information.
And another thing, I know there's other people you want to introduce, but I'm just quickly going to put this out there. Every Life, which some of you may know, works on creating legislation to help the create treatments and research and now access for the rare disease community. And one of the things that I was just contacted from was Representative Gottheimer from New Jersey, and he wants to get together with some sarcoidosis representatives because he wants to get more involved. His mother had passed away from sarcoidosis, and he's been a good advocate, and he was great for me in New Jersey, supported everything I did with trying to get proclamations and anything else. So if anybody is going to see him, or I will update everybody on what his plan is, but he wants to get sarcoidosis more represented in the advocacy and active legislation. So I will, report back what he wants to do.
Yeah, keep me posted with that.
Yeah,
that would be interesting. And also a good person too for that would be Heidi Junk.
Yep.
Okay.
Yeah, she's in DC too.
Yeah, she's up north also.
Is she like from DC?
Yep, she lives in DC.
Oh, I need her for sure.
Okay, I will introduce you to her.
Great.
And Wendy, I noticed that you put something in the chat. Are you able to speak?
I'm not sure.
Okay, yep, we hear you.
Oh, okay. Yeah, I'm going through some emotional battles right now. I just went to my one of my doctors, and I'm on Cellcept and prednisone for neurosarcoid and pulmonary. I am having tremors at night, and they told me that it's better for me to have the tremors than not take the medicine, because this is the only medicine that they have, then the mexocytrate, whatever it's called, to combat, to try to get rid of the lesions in my spine. I'm very depressed because I've gone through a lot of crap like we all have.
Okay. Yeah, Cellcept, I was actually on Cellcept. It actually did help me. Another one of my great misdiagnoses, what for me was that I had, they thought I had essential tremors. But for me, I ended up having Parkinson's. But the Cellcept, and what I did with the Cellcept so I could sleep and helped at night was, now I'm drawing. Why am I drawing a blank?
Was
I
it
have to.
CBD oil?
No, I actually I used an actual medicine, clonazepam. Yeah. It actually helped me sleep, and because it helped me for the tremors, I'm actually using it again now because I was having a lot of trouble sleeping.
Is it
And
like in it? What is that? An antidepressant?
yeah, it's actually, it is. I can't think of exactly what the name of what it would be considered, but I know they use it for depression, anxiety, and it really it calms me down. That's the best way to describe it. It really does.
Yeah, because
Because
I have anxiety too.
yeah,
Klonopin is used to treat certain seizure disorders in
yeah,
adults and children and panic disorders. And
yeah,
it's also used as a sleeping. I was just reading off of Google.
yep. So yeah, that
My doctor said that they probably won't give me anything than a medicine for anxiety.
they wouldn't.
Yep. I was very
I
upset
mean,
about it because I have not literally slept in 2 weeks.
Yeah,
have
it
you
says
thought of
Klonopin is I'm sorry.
Go ahead.
It relaxes the mind by effectively calming the neurotransmitters, and it prevents muscle spasms, reduces anxious feelings, and causes sleepiness, and it's good for anxiety.
Clozapam?
Klonopin.
Klonopin.
I'll send it to you.
Sorry, I'm asking my husband to write it down.
I'm going to send it to you right now.
Okay, thanks.
I'm going to send you the brand name and then the generic name.
Okay, thank
Okay.
you.
Anytime.
With that, Wendy, I was going to say what you may want to do is actually see a psychologist because they can prescribe the medicine for you.
That's a psychiatrist. Psychologist can't prescribe.
Oh, it's a psychiatrist? Okay. Yeah.
Psychiatrist.
Oh, a psychologist can't prescribe?
They can't. They can recommend. They can't prescribe.
Oh, okay. Right. So yeah, the psychiatrist then is the one you want to see.
I don't know, because of Cellcept, I was told that I got to be really careful, of my inner, being one-on-one with people, because I can get sick.
Well, yeah, the Cellcept is an immune suppressant.
Mm-hmm.
So a lot of our drugs are, unfortunately. Which for me, it's kind of weird because to me, it wouldn't make sense to use an immune suppressant when our immune system is what's causing our problems a lot of times. But it actually, I mean, for me, Cellcept did work, but the problem with drugs with me is they work for about 6 months and then it stops on me. I don't know why, and that's almost every drug that I've tried. So yeah, but Cellcept actually, out of all of them, worked the best for me. I didn't get sick while on Cellcept, and I was pretty active. I was actually more active than I am now when I was on Cellcept. It's it's just like any other immune suppressant is. You just gotta watch, who you're around. If you know somebody's sick, stay away. But that's us normally. Mm-hmm. That's really us normally. We're not, we can catch a cold like that and hold on to it forever. Mm-hmm. So, for me, I don't know why, but I don't know if anybody else tried Cellcept, but for me, I had no side effects. I loved it. I was so mad when I had to get off of it.
I was on it.
You think that because I'm on prednisone, that it's accelerating my prednisone?
I can answer that a little bit.
Yeah, go ahead.
I was on the Cellcept for 9 months, and they use the steroids. They use it with steroids for a reason, because they work together better to reduce the side effects you would have if you were to just take the Cellcept by itself. So as awful as it sounds, it actually is better for you to have them together.
I'm actually on Cellcept by itself, I had to go off the prednisone and go on to the CellCep because the prednisone it makes me kind of like a nut. I mean, I'm like manic and I'm not a nice person, even at work.
I think we've all had to deal with that on steroids some point or another.
And then prednisone also increased the pressure in my eyes. So my pressure in my eyes was like 34 and 36. So almost severe glaucoma level. So I had to taper off of prednisone really fast and go on CellCep. And I've been on CellCep for about 8 months now, and I've not had any problems. And I work in a hospital, so I'm around sick people all the time.
Mm-hmm.
And I
As
have
long as you,
three grandkids, so.
well,
Yeah.
I mean,
And I go to a pulmonary specialist at the University of Iowa who's a SARC specialist. And he's the one who got me off the prednisone and put me on the CellCep. So
Yeah. One thing you really have to remember is that each person with sarcoidosis is different. They call this disease a snowflake disease because no two snowflakes are the same. No two sarcoidosis patients, A, have the same symptoms, B, have the same reaction to medicines. So each person, unfortunately, is totally different from the next. So it's unfortunately with us, it's hit and miss. It's always been that way.
It is, and I think that's why we have to be our own advocates when we go to the doctors.
Exactly.
Well, now that you said that, it's hard to be your own advocate though, because like here in Rochester, New York, there is no doctors that are really treating sarcoid. There's only a pulmonary clinic for sarcoid, and they don't even know hardly what to do. That's what my doctor told me today.
Wendy, I'm gonna send you to a doctor, a rheumatologist. That's what CellCep really is for, is your rheumatology. And I'm gonna send you a doctor from Rochester. I am taking your email down because they chose your email when I put it by your name. I'm gonna send you a couple of doctors over in Rochester. I know for a fact are great sarcoidosis doctors.
Yes, but my doctors try to get me to see rheumatologists, and nobody would take me because there's hardly any of them available.
Okay, but I can.
So can you help me with that?
Yeah,
my
actually,
doctor tried to put me in referrals, and it didn't work.
Okay, what I'm gonna see, I'm not. It's gonna have. I'm sorry, it's gonna be next week. I put in the chat room. I put my email down in the chat room, in the chat part. Take my email. Email me on Monday because I'm going.
I see the chat button here. I'm sorry, I'm brand new to this.
Okay, click on that chat. I'm actually going to put my email on there again. So this way you can contact me.
All I see is Mary Molino. Bye. That's.
Oh, you know why? Probably because you came in a little bit later, so you probably didn't get the first part of it. But I just sent it to you. Sent it again.
Oh, I got it.
Okay. Email me. Oh, wait a minute. Instead of the 2, that's supposed to be an @ It's frank@sarcoidosisofli.org. And email me on Monday. I'm gonna actually I'll work on talking to the doctors over there because I actually know of 2 doctors over there.
Wow.
And I actually know them pretty well, actually.
Wow.
So let me see if we can if they have any room. I don't know. I'm not gonna promise anything, but at least I could try. Oh wow, look at this. Now there's 2 of me.
I was really saddened by the fact that my own doctor could not do it,
Yeah, we'll help you out on that. At least I know I can give you some references, not just one. I know of, like I said, I know of 2 really good rheumatologists, and I can, I called them both a couple of times for FSR, which is a national organization, to get recommendations, and B, to help another patient. So hopefully we'll be able to help you out. I'm going to try my best.
Wow, thank you.
No problem. But yeah, I mean, I know their area. They're actually now University of Rochester is actually trying to get a sarcoidosis clinic built inside the.
Oh, really?
Yes. So that's
So
another
my
thing. That's
doctor
why.
did not tell me that today.
Yeah. That's the one thing. That's
My
weird.
sister was with me, and she got really discouraged too. She's,
Yeah.
you
A lot
know,
of doctors. I don't know why they don't want to.
they don't want
If
to
they're not
deal with
part of
it,
it.
right?
Yeah. If they're not part of the group, they don't like to. Um, recommend somebody. I don't know why. I've heard this many times. I'm sure, Kathleen, you have heard that too. Some doctors just don't like to recommend. I think maybe they feel culpable, and that kind of scares them. I don't, but I can't. I don't know. I just know that I've gotten that myself. Kathleen, have you ever had that problem?
Yeah, most doctors don't want to tell me who else to go to.
Yeah.
I want to tell them where to go, but yeah.
Yeah, my sister's like, well, it's like she said you felt like you wanted to tell the doctor where to go, didn't you?
Yeah.
And I'm like, because she's my bigger sister, and
Yeah.
Yeah, and the funny thing is that we're the patients, we're paying them, and we're like, really?
Yeah.
I don't have any problem telling any of my doctors
Me
what
either.
they need to hear if they want to keep me as a patient.
Oh,
But that's
I
just me.
I'm like the complete opposite of you. I feel like I'm at their mercy.
No, you are the advocate.
Yeah, you
Remember
have
that.
to remember
It's
they
your
work
body.
for you.
Yeah. It's your body. And like Kathleen said, you're paying them.
Mm-hmm. Yeah.
And I could tell you, I have gone through probably close to 20 different doctors for all my problems. I just recently told my cardiologist where to go. I'm not afraid because, it's your body. It's, either you're going to, I always say you have two choices. You roll up into a ball or you fight. And when part of fighting is being your own advocate.
Yeah, and I noticed that most of people that have sarcoid are fighters.
Yeah. Well, yeah.
I wonder if it's something, to do with that. I don't.
Well, I mean, I can only talk about my own experience, and my own experience is because it's sarcoidosis is a long, unfortunately hard disease, and if we don't fight, I think, like I said, you could roll up into a ball, and and your body will give up, and
Yes.
that's something that I personally don't want. I just and I think that with this disease, it's so little is known, but it's people like us, all of us that are in here, keep on talking to help each other, and like I said, I could send you doctors, and I'm not afraid to talk to doctors. So when I talk to the doctors, and if I send them to you, is because I really do trust them. I don't just do it for. I don't say, oh well, this one looks okay. I don't know, because it could be that's a waste of time.
Mm-hmm. Yeah.
So,
And honestly, we do need to talk to our doctors and point blank them. And if they're not going to do the right thing, or they're not going to learn about sarcoidosis, or they don't know enough about sarcoidosis and they're unwilling to learn, then it's time for another doctor. We do pay them.
That's the
I
key.
know.
They're
It's
unwilling
scary.
to learn. If they don't know it already, that's fine. But if they're not unwilling to learn about it,
Right.
then that's a big issue. Because
there's enough.
And the other issue is they need to listen.
Exactly.
Some doctors don't listen. You can talk, but they don't listen.
Oh, for sure.
Yeah, that's what my sister was saying. She said you were talking and he wasn't listening to you. He was
he's
just
not the
going with
doctor
his
to be
own
there.
thoughts.
Don't feel like that's the one thing a lot of sarcoidosis patients feel is like, all right, well, he's a sarcoidosis doctor and blah blah blah, but if he's not listening to you, he's not the doctor for you. End of story. I mean, I can't stress that even more
Not to
anymore.
toot my own horn here, but I feel sometimes that I've helped my doctors over the last 10 years to learn a lot about sarcoidosis. to the point where at least some of them now know what I'm talking about. And the ones I have right now are excited when I come in the room because they want to learn. Those are the best
Awesome.
doctors, best doctors.
Yeah, because I tried to bring up something with the doctor today and my pulmonary doctor about this, you know, what is it called? Gel Jance? Is that the name of the inflammatory?
Mm-hmm.
Yeah. How I met somebody over Facebook. She said that she's doing really well on it, and it's, you know, getting rid of her sarcoid. She's one of the patients. I don't have anything to do with it. They both tell me nothing to do. We don't get into that. We don't get into test trials, nothing, blah, 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 both of them.
Yeah, that sounds like a doctor you don't need to be with at all.
But that's the way they are.
Not all, not all. Because Kathleen, we could tell a story about our doctor, Dr. Morgenthau, who's actually a great doctor. He's out on New York City. He's one of the top. When Kathleen first met him, she could not stand him. Right, Kathleen?
Down. He
What?
had no bedside manner. He was not
Neurologist,
nice.
or what was he? Was he a
What's that?
pulmonary? Was he a pulmonary?
He's considered a sarcoidosis specialist. So he
Mhm.
does the whole body. Right,
Yeah.
Frank?
Yep, he's one of the top sarcoidosis specialists. But the thing is once you break through his exterior, you find out that this guy, A, he knows his stuff, and B, if you stand up to him, he'll listen. And that's why I stayed with him, because for me, yeah, I know I always say this, Kathleen, I don't care about bedside manner too much. I do care that he listens to me. I always kid around with him. Like nobody I know of could do this. I call him Dr. House because that's pretty much how he acts. But it took me a long time to say that to him. But he said if he ever heard anybody say that to him, he'll come back at me. So don't ever tell him that.
Wow, so next time I see him, Frank, I'm going to get you back. But no, Wendy, I didn't like him at first in any aspect. I had seen his boss, and unfortunately, that doctor passed away at his desk. And when I was thrown into seeing him, he went against everything that his boss had told me. And I said, no, Dr. Tierenstein said not to do this. No, Dr. Tierenstein said not to do that. It was like 3 different things, and they were big things. And I just decided not to see him. And it took me, I guess, about 7 years, Frank, something like that, 6, 7 years, to go back there just because my system's getting worse. And Frank said that he has gotten better. And I'll be honest with you, this time round when I saw him, he had a little bit of a bedside manner. He didn't mention all 3 things that his boss had told me not to do, and he was trying to get me to do, which I did not, because I'm a strong person too. So I really feel that we have to be speaking our minds. I'm not fighting with the doctor. I'm not telling him, no, I'm not going to do that. But I say to him, this is what it says, or this is what somebody else has told me that with sarcoidosis. And I had an endocrinologist on the island, Frank knows, top rated. And he said that I needed a biopsy of my lymph nodes. And I said, no. I have sarcoidosis. And he says, I have no idea about that. So the next time I came, I brought him a packet all about endocrinology and sarcoidosis. And I said, read on this. I paid my $40 copay and I went home. And then 3 months later, I go back and he's like, are you ready for the biopsy yet? I said, did you read the papers? He goes, no, I don't have time for that. So I said, I don't have time to be your patient and I'm not paying today's copay. Have a very nice day. So I have gotten a little bit of emphasis. If I'm going to give you stuff that I printed out and you can't read it, then I'm sorry, I can't be your patient. And I found another doctor, another endocrinologist who didn't know that much about sarcoid, but started reading up on it. And he looks at me, he goes, you have Hashimoto's. You don't need a biopsy of your neck. It's like, oh, thank God. So really, you really have to call them to task. They are still human beings, even though they're supposed to be smarter than we are.
Yeah.
But so, but we can help you, Wendy. That's what we're here for. If you have any questions on anything that, if you aren't able to find another doctor and you need to question this doctor, please feel free to email me. I check my email all the time. If you don't feel like it, if this sounds weird, you know, say, well, one of the best things I do, and Kathleen does this too, is we won't like a like I'll say with you, Kathleen, like they want her to start Remicade. She's like, no, wait until I'm done with all my other tests before I start. And this way you can also gives you time to look it up and make sure that it's right for you. And you don't have to take the medicine right away because it's not gonna help like that anyway. Um, so I really investigate. I'm a big time investigator of all my meds because I also have other diseases too. I have Parkinson's. I have IBS. So there's a lot of medicines I can't take because of my stomach.
It's so funny. I have IBS, but they told me they think it's my sarcoid.
It could be actually, but what happened for me is like I said earlier, I ended up with a hole in my colon from the prednisone, but it was the prednisone acting up with the IBS. Bless you, whoever that was.
Thank you. Sorry, I thought I was on silent.
But yeah, so
How long were you on the prednisone that happened?
I unfortunately, this was before I started investigating a lot of my stuff. I learned the hard way. I was on between 40 and 60 milligrams for almost 2 years.
Oh.
And that was really a bad idea. And needless to say, I got rid of that doctor real quick as soon as I found out what happened. So, but you know, we all have been where you are. So we can help you as much as we can, and don't be afraid to ask.
I did finally meet somebody here in Rochester, New York, because I've been really trying to reach out. I think I've reached out with you too, Frank. I don't know if you remember, but because I was having problems.
Yeah.
But I don't want to get in detail because privacy for her, but she does have sarcoid. And I did let my doctor know about, how I've been having the tremors and not sleeping. I mean, it's 2 weeks without sleep is.
Yeah, that's not good for you.
I've, and she said she's not had any trouble with the with the medicine. So, I've had a lot of complications. I've had a brain bleed from the spinal tap, and they gave me the spinal tap and the biopsy all at once.
Yeah,
I ended up having
a lot of doctors do that.
Yeah, but thank God it cleared up. It was a freaking miracle. It's all clear. My brain's all clear, and they're saying that it's the prednisone.
How much prednisone are you on?
I was on 40. Now I'm on 30.
Okay. I was saying this earlier. I don't know if you heard. It's like when you're over 20. I don't know how long you're on it for. You shouldn't be on it for more than a couple of months.
Like how
long have you been on?
I've only been on it almost 2 months, and they want me to be on it for another 3 months.
Yeah, they're pushing it. They're pushing it because
So
you also
they want me to be on it another 3 months because of it clearing up my brain, and they think that they put me on the cells up, so I'll be off of it in 3 months.
Okay, all right. I mean, like I said, everybody's different, so I can't, speak on that per se. And if it is helping the brain, and I'm sure that but I wouldn't if you go over 6 months, I would really question it.
Because remember, she's going to be on the taper down too.
Yeah.
Well, I was going to be on a taper down starting today, but then he decided not to taper me down.
Yeah. We talked about this earlier. Make sure if you don't cold turkey it.
Yeah, he said don't cold turkey it.
Yeah.
He said do not cut your pills in half. Do not.
Yeah, if you go cold turkey, we talked about it earlier. It can affect your heart and a lot of other parts of your body. It's really your body gets dependent on it. Your body may what happens is your body actually makes prednisone or steroid prednisones naturally, about anywhere from 5 to 10. So if they ever, if they taper you down to 5 and 10, you could stay on that for a while. But when you start going over, your body's starting to, depend on it, and your body doesn't make the normal 10 that it normally makes. So if you taper off, basically say you're on 40, you actually if you go cold turkey, you're dropping 50, because the 10 that that your body was making is not making it anymore, because you're getting this artificial. So, but yeah, we could, like I said, I would definitely send you to doctors. I will actually talk to the doctors next week, and I'll see which ones actually are taking. And what if you could, when you email me, like just tell me like what kind of insurance you're on. You can tell me that in the email, and this way I could give them as much information as I can, and make sure that it's not, I'm not telling you go see them and your insurance won't take them, or it's a fruitless journey. But I do know of 2 that are really great in Rochester, really good.
I really hope it works. I just have had such bad luck.
I know it's
And
a hard
all they're telling me is there's a shortage of them,
Yeah. Unfortunately, fortunately, one of the good things that FSR is doing is trying to bridge the gap between the new people that are actually coming out of researchers, and also the doctors, the new doctors, to bring into sarcoidosis. They're giving them grants, so they actually want to become sarcoidosis doctors, because unfortunately, a lot of our sarcoidosis doctors that are around now are getting older, and there's nobody who's backing, there's no new crop. So that's one of the things that FSR is trying to bridge and get some newer people involved in it.
Well, it's funny you said that, because when I was in the hospital, before being diagnosed with sarcoid, there was a whole bunch of students from the U of R, I think, that found my sarcoid. I was laying in bed and I didn't even know I had it in my lungs, okay? And they said, "Ma'am, you're not breathing right. Do you have sarcoidosis?" I'm like, what's that?
They were, like I said, Rochester is actually,
they were students.
Rochester is actually making a big push of making their own clinic. So that's why I was saying
But I was at Rochester General when this happened, and they don't know anything about it. But they were
university
going over to General. That's how they do it here in Rochester. They come over. General's the #1 heart hospital, and then they all come over, to be in this hospital. I don't know I don't think they get paid. I don't know how it works with them. I don't know anything about it.
But the University of Rochester is actually becoming really very well in a lot of different fields, but sarcoidosis is one of the big ones. So we will try to help on that.
Hi, Regina. By the way, they knew that before testing me.
Yeah, that I think because since they're trying to make a clinic, they're actually trying to teach the students now, because that's happening here on Stony Brook too. Stony Brook University is trying to make a clinic here, and a lot more of the students are actually learning. I actually had a student that wrote a whole article and did a whole big thing on me about sarcoidosis. So when a hospital, because if they open the clinic, they get more money. It just comes down to that. And so they're going to try to push it with a lot of the newer doctors to make sure that the clinic is actually, it shows that it's viable. But Regina, do I see you?
Hey! I'm sorry it took me so long. I totally forgot it was tonight.
That's okay.
Plus, I was packing and getting ready for tomorrow to leave out tomorrow. So I got an early morning flight.
Oh, okay. Mary, just so you know, Regina will be at Rare Disease Week. So, you need to try to hook up with Regina.
Oh, excellent. You need to find.
Mary,
Yep.
we will be meeting on Thursday with the guy from the public policy. They said the
Right.
meeting was already scheduled. I got the
Right.
email, I think yesterday.
With
I'm gonna
Steve
miss it.
Silvestri.
Yeah, I'm gonna miss it. I'm actually part of the public policy myself group, but I won't be able to be there in person. But he's a
Were
nice
you
guy.
part of the public policy for the community congress?
Yep.
Yeah.
Yeah.
Okay, because I sent you something recently about that. I wasn't sure
Yeah.
because I couldn't find your you might be, were you on for sarcoidosis of Long Island, or were you on for something else?
No, well, I'm trying to, yeah, I'm on at Sarcoidosis of Long Island, but yeah, I actually just talked to Steve the other day, because I missed the last webinar because I wasn't feeling well.
Yeah, they're doing a new set in March, so you'll be set for the next one.
Yeah. Yep. Yeah. So yeah, I talked to him and he sent me the info for March and everything. So
oh, good.
Yeah, I plan to be more involved. I told him that I'm gonna have to be more involved from here. I really can't be traveling as much. So,
No,
but he's fine with that.
No, that's fine. And I got you. I'm down here, and that's part of the reason I moved down here was to represent for sarcoidosis. So, I'm happy to do that.
Yeah. Thank you. So I
Yeah.
wanted to, we only have 5 more minutes. So I just wanted to see if anybody else had anything last little bit. And while I'm at it, I'm going to be really shameless. I'm going to look what I got.
Yeah. We're so proud of you, Frank.
It's
Congratulations.
for those who are on the phone.
It's awesome.
For those who are on the phone, I actually wrote a book. It's called Walking in Silent Pain. It's about it's actually a full journey of my life because at 5 I had leukemia. So I went from leukemia to then and just stuff with my life and how I handled it. So I kind of wanted to let people know. And so I wrote this book, and if you ever want to read it, it is on Amazon. If you ever, it's on Kindle, and you could get a paperback. But the proceeds are actually going back to FSR. So it's for a good cause, and it does talk about sarcoidosis, my fight with sarcoidosis also, and why I became an advocate, and yeah, so. And like I always say about the book is it's perfect, imperfectly perfect, just like me.
Awesome.
Can't wait to read it.
Well, thank you all
like,
for your support.
You can't get it like at Barnes and Noble or
Not yet. What's going on is I self-published at first through Amazon, and I'm working with a publishing company. Once they see sales go, and they actually are, thank you everybody who had they are actually going to publish it and make it a hard copy and a soft copy.
Awesome.
And
When's
it'll
the
be
book
bundled.
signing?
What was that?
When's the book signing?
Well, I'm gonna be at my walk on April 18th. If anybody wants to sign book, then we're gonna put it in a raffle. This weekend, anybody who's at the training, if they want, I could sign a book there. So I will be, I'm gonna be. Oh, I also gonna be at a walk in Westchester, signing a book signings there. So I'm gonna be around a lot. So if anybody, does want a book signing, I'm more than happy to sign a book for you guys. And I do appreciate it because I wouldn't be where I am without you guys. I always said that.
I'm sorry, where can you get the book though?
Amazon.
Okay.
Amazon right now. It takes like, if you order it, it takes maybe like 2 days to get it from them, because way Amazon does it right now is they make the book when you order it. They don't make extra books. It's really book to order.
Wow.
Yeah, so it's kind of interesting. Each one gets their own little special copy.
Cool.
Yeah, but thanks. I do want to thank everybody because, like I said, I wouldn't be where I am.
Well, thanks
I
for
would-
writing it. I'm sure it will help. Maybe, you know, people can
Yeah.
start giving it to their doctors.
Yeah, and the thing, like I said, is it's on the cover. It says autobiography about strength and resilience, and that's what I want people to take out of it is how how I fought through the things that I went through, and hopefully if it inspires one person, then it's done its job. That's the way I look at it.
That's good.
It's awesome.
All right. So any last things before we close this up?
Yes,
Yes.
you're all my heroes.
Thank you.
That. All of you.
Thank you, Ruby.
Thank you.
Yeah.
Mhm.
We're in this together, guys and
Yes.
girls.
Yeah.
We're in it together. You know, I mean, if we don't have us, who do we have?
Right. Everybody keep rolling.
Hey, Frank. Hey, I just wanted to apologize. I haven't been around these last few weeks. I've just been like majorly busy.
Yeah, don't worry. I mean, Kathleen and I have been banging our heads, going crazy. We totally understand, so don't worry. Thank God I have Kathleen.
Well, it's actually slowing down for me now. I've been busy at work and working a little later hours and all that good stuff.
Well, I'm glad that you were able to come by today, and
Is there any way that you can get your there's like Sarcoid Facebook and stuff that you can put this on there, that there's this group?
I've been putting in some, but I can send you the link, and any groups that you guys are in, you're more than welcome to, as long as the admins don't mind. I don't think they would, but if I've been trying to get to as many as I can, but I'm not part of all of them, and part of the reason is some of the groups are great, and then there's some others that it's not so great.
Be desired.
And it's just not for me, some of the groups.
I just thought that maybe because I noticed on there's people from all over the world on those.
Yeah, we can.
And, who knows what's going on in Germany? Who knows what's going on in the United Kingdom? Because they have more, it seems like they're like really trying to find an answer. I don't know. It just seems a lot of.
Yeah, well, that's where FSR comes in. They actually, they were keeping us informed. How's that sound? Right, Regina?
Right.
Regina, that's you trying to fix, okay?
Trust me, girl. I actually, what we're doing now is there's a bunch of us that are moderators on this group, have a lot of experience, and like some people just know a lot about research. There's others that know a lot about being advocates. Some people know more about mental health. That's why I picked the moderators that I did, because have a well-rounded. So in this group, if you do have any more questions, in our Facebook group, please put it in there. The online sarcoidosis support group, whatever, on Facebook, put it in there. We'll answer it, because there are a lot of things going on throughout the world that are doing a lot more than we are right now. But yeah, please put it in the Facebook group, and we'll definitely try to get back to you.
Thank you
All
very
right.
much.
Well, good night, everybody.
Yes, everybody have a good night, and see you next month.
Okay.
See you tomorrow, Frank.
See you tomorrow, Regina.
Safe travels.
Y'all take care.
All
Bye.
right.
Thank you.
Bye.
Paul?
Yeah.